end of the month. All right, observed every year on February 14th is National Donor Day. Today, a day to raise awareness of the life-saving benefits of organ donations. And Valentine's Day is the perfect day to spread the love by saving and healing lives through donation. Here today to talk about the importance of organ donation is Dr. Glenn Morgan, the Chief of Surgical Transplantation at Hartford Hospital. Dr. Morgan, thanks for being with us.
Thank you for having me.
Such an important topic, as we've discussed. How is Hartford Hospital honoring National Donor Day this year?
Yeah, Hartford Hospital, in partnership with New England Donor Services, will be displaying over 140 luminary bags in honor of the living and deceased organ donors and tissue donors that gave the gift of life here at Hartford Hospital in 2021. The luminaries have been personalized by staff from the ICU, from the OR, and from our transplant offices. So it's a very special remembrance that we're very proud of.
That's very nice. We're looking at them now, some nice personalized touches. All right, talk to us about organ donation and how this process works for a donor.
Yeah, so the first thing to understand is that there's the difference between living donation and deceased organ donation. Living donors, particularly for kidney transplant, are vital to getting transplants to our recipients to get those people transplanted. Deceased donation is different in that that's when someone has passed away and they've made the decision, either using an organ donor registry or signing their driver's license or sharing their decision with their family to donate their organs should they pass away. And so both modes of organ donation are extremely important to our efforts to get people off transplant lists and get them back home to their families.
All right, Doctor, how are donor recipients matched to a donor?
Yeah, so it's different based on whether you're a live donor or a deceased donor. For live donors, obviously there's an element of control that the family or that the recipient gets in knowing who the donor is and knowing when the operation can be. So we can plan things like the anatomy. We know exactly what is favorable. We know who the donor is. And so we can do more planning in this sense with a live donor than we can in a deceased donor. The scenario of using deceased donors is such that we generally have only hours of notice in order to match a donor with a recipient. Both are very successful, but we strongly encourage the use of live donors, especially in kidney transplantation, whenever we can.
All right. And Doctor, talk about how the community partnerships, such as the one between New England Donor Services and Hartford Hospital, make the donation transplantation program how it is today.
Yeah, they're critical. They're absolutely critical because awareness of the problem is what spreads the word to people that need to know and can make the gift of life. So we partner with New England Donor Services throughout this area. Also, organizations like the National Kidney Foundation, the American Liver Foundation. If we can't get the word out, then no one is going to be able to benefit from the gift of life. So it's very, very important that we be able to inform the public as to what their options are and how to go about giving the gift of life.
And you said, really quick, lastly, to have a talk with your family as well. Even if you signed up and on your license, you should just let them know that you're okay with that.
Right. Sharing your decision is really important. Being on a registry is critical, but just it's not an easy conversation. It's not something people just sort of casually, but it is something that they should share.
All right, Dr. Glenn Morgan with Hartford Hospital. Thank you very much once again for shedding light on this important topic.
You're welcome.
Thank you. Well, Hartford